Here's what happens to the body after contracting the new coronavirus. Coronaviruses cause respiratory illnesses, so the lungs are usually affected first. Early symptoms include fever, cough, and shortness of breath. These appear as soon as 2 days, or as long as 14 days, after exposure to the virus. Damage can also occur in other parts of the body, especially during serious illness. What happens when you got infected by COVID-19? COVID-19 affects lungs. As with other coronavirus illnesses, including SARS, MERS, and the common cold, COVID-19 is a respiratory disease, so the lungs are usually affected first. While fever is at the top of the Centers for Disease Control and Prevention's list of symptoms, not everyone who gets sick has a fever. In one study in the Journal of the American Medical Association, researchers found that around 70% of patients hospitalized with COVID-19 didn't have a fever. Cough is more common. Only 11 to 40% had shortness of breath. Other less common symptoms included confusion, headache, nausea, and diarrhea, loss of taste and smell. The severity of COVID-19 varies from mild or no symptoms to severe or sometimes fatal illness. Older people and those with chronic medical conditions appear to have a higher risk of developing severe illness. This variability also shows up in how COVID-19 affects the lungs. Some people may only have minor respiratory symptoms while others develop non-life-threatening pneumonia. But there's a subset of people who develop severe lung damage. Other organs affected by COVID-19. The lungs are the main organs affected by COVID-19. But in serious cases, the rest of the body can also be affected. In patients who become severely ill, a good proportion of those patients also develop dysfunction in other organ systems, Evans said. However, she says this can happen with any severe infection. This damage to the organs isn't always directly caused by the infection but can result from the body's response to infection. Stomach and intestines. Some people with COVID-19 have reported gastrointestinal symptoms, such as nausea or diarrhea, although these symptoms are much less common than problems with the lungs. While coronaviruses seem to have an easier time entering the body through the lungs, the intestines aren't out of reach for these viruses. Earlier reports identified the viruses that cause SARS and MERS in intestinal tissue biopsies and stool samples. Two recent studies, one in the New England Journal of Medicine, report that stool samples of some people with COVID-19 tested positive for the virus. Heart and blood vessels. Evans says COVID-19 can also affect the heart and blood vessels. This may show up as irregular heart rhythms, not enough blood getting to the tissues, or blood pressure low enough that it requires medications. So far, though, it's not clear that the virus directly damages the heart. In one study of hospitalized patients in Wuhan, 20% had some form of heart damage. In another, 44% of those in an intensive care unit (ICU) had an irregular heart rhythm. There are also signs that COVID-19 may cause the blood to clot more easily. It's not clear how much this plays in the severity of the illness, but clots could increase the risk of a stroke or heart attack. Liver and kidneys. When liver cells are inflamed or damaged, they can leak higher than normal amounts of enzymes into the bloodstream. Elevated liver enzymes aren't always a sign of a serious problem, but this laboratory finding was seen in people with SARS or MERS. Some people hospitalized with COVID-19 have also had acute kidney damage, sometimes requiring a kidney transplant. This also occurred with SARS and MERS. Dr. James Cherry, a research professor of pediatrics in the David Geffen School of Medicine at UCLA, says the kidney damage may be due to other changes that happen during coronavirus infection. When you have pneumonia, you have less oxygen circulating, he said, and that can damage the kidneys. Immune system. With any infection, the body's immune system responds by attacking the foreign virus or bacteria. While this immune response can rid the body of the infection, it can also sometimes cause collateral damage to the body. This can come in the form of an intense inflammatory response, sometimes called a cytokine storm. The immune cells produce cytokines to fight infection, but if too many are released, it can cause problems in the body. A lot of the damage in the body during COVID-19 is due to what we would call a sepsis syndrome, which is due to complex immune reactions, Evans said. The infection itself can generate an intense inflammatory response in the body that can affect the function of multiple organ systems. Follow this healthy practices to protect yourself. Wash your hands often with soap and water for at least 20 seconds, especially after being in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, and practice social distancing by keeping at least 6 feet away from others if you must go out in public. Wear a face mask and face shield to cover your mouth and nose when around others and when you must go out in public. The face mask and face shield is meant to protect other people in case you are infected. Cover your nose and mouth with a tissue when coughing or sneezing and throw the tissue away after use. If a tissue isn't available, cough or sneeze into your elbow or sleeve, not your hands. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, handles, desks, computers, phones, keyboards, sinks, toilets, faucets, and countertops. Follow the health guidelines and practice social distancing. Always wear masks and protective face shields. Stay safe and thanks for watching.